Menopause and hormone replacement therapy. What you need to know. Hi, I'm Dr. Rangi, and today I want to talk to you about something I hear constantly in my practice. Do I really need to take hormone replacement therapy for menopause? With all the information and misinformation out there, I understand why this question comes up so often. The truth is that the hormone therapy isn't right for everyone, but it's also not as dangerous as many people think. Let me help you understand when it makes sense and when it does not, and what are your options out there. First, let's talk about why there's so much confusion. Back in 2002, a major study called the Women's Health Initiative made the headlines. It reported that hormone therapy increased the risk of breast cancer, heart disease, and stroke. Now, millions of women stopped their hormones overnight, and the doctors became afraid to prescribe them. But here's what got lost in this panic. The study looked at older women. The average age was 63, and many of them were more than 10 years past menopause. And now we know that timing matters enormously. Since then, researchers have gone back and looked at the data more carefully, and what they found changes everything. Hormone therapy is actually quite safe for women between the ages of 50 and 60 who are within 10 years of menopause. But for women over 70 or those who start hormones many years after menopause, the risks go up significantly. This is called the timing hypothesis. And it's key to understanding when the hormone therapy makes sense. So, when should you consider hormone therapy? Here are the situations where it can really help. If you are having severe hot flashes or night sweats that are disrupting your sleep, your work, or your quality of life, and you are between the ages of 50 and 60 years old, hormone therapy is the most effective therapy available for you. Nothing else works as well or as good. Hormone therapy will definitely make a lot of difference. Now, if you're dealing with vaginal dryness, painful intercourse, or recurrent urinary tract infections, these are signs of what we call as genitourinary syndrome of menopause. This happens because low estrogen causes the tissues in your vagina and urinary tract to thin out. And I see women in hospital all the time with serious urinary tract infections that keep coming back again and again because this problem wasn't treated or is not being addressed. So we give low dose vaginal estrogen, which is considered to be safe, effective, and can prevent these infections. If you're struggling with joint pain, like I had, mood changes, like I had, sleep problems, like I had, related to menopause, hormone therapy can definitely help you with all of these. The key is this. If your symptoms are affecting your daily life and you are in the right age window, hormone therapy is a reasonable option to discuss with your doctor. There is data showing that there's a lot of working women who get affected in their work time and their productivity because they're not taking care of themselves for their menopausal symptoms. And that is huge production lost. So even employers should look into this. Now, when should you not start hormone therapy? If you are over the age of 60 and haven't been on hormones before, the risks start to outweigh the benefit. The research is clear. Starting hormone therapy after age 60, especially after age 70, increases the risk of heart disease and stroke. If you have a history of breast cancer, blood clots, heart disease, or stroke, hormone therapy is not for you. And if your symptoms are mild and manageable, you may not need hormone therapy at all. Not every woman needs hormone replacement therapy, and that's perfectly fine. Certain nutrients and plant compounds have been shown to support women through this transition as well. One of them is black cohosh and soy isoflavones, and they help not only reducing the frequency but also intensity of hot flashes for some women. Magnesium can help support the sleep quality, muscle relaxation, and mood stability. Omega 3 fatty acids and curcumin can help modulate your inflammation, which can contribute to joint discomfort and overall well being. Vitamin D supports your bone health and immune function. B vitamins play a role in energy and production um, and nervous system balance. Now, supplements are not an overnight fix. Most take 4 to 8 weeks of consistent use before meaningful changes are noticed. The key is selecting the right combination for your specific symptoms and your health profile, and using them as a part of broader strategy that includes sleep, nutrition, stress regulation, and movement, and of course nutrition. But let me be honest with you. Supplements will not give you the same benefits as estrogen. They can help you take the edge off, and they are a good option if you are at a higher risk for hormone therapy. If you prefer a natural approach or if your symptoms are mild to moderate. If you're having severe symptoms that are really affecting your life and productivity and um, relationships, then supplements alone may not be enough. And they won't protect you from recurrent urinary tract infections or severe vaginal dryness the way the vaginal estrogen does. Think of supplements as supportive options, not a replacement for hormone therapy when hormone therapy is truly needed. Here's what I want you to take away from this. Hormone therapy is not something to be afraid of. If you are the right candidate. The safety concerns from 2002 were based on older women starting hormones late. If you are between 50 and 60 within 10 years of menopause and you're struggling with symptoms, hormone therapy is safe and effective. If you are over 60 and haven't started the hormones yet, I would not recommend starting now. The risks are too high. And if you're somewhere in between, or if you prefer to try a gentler approach, first, our Hormone Health Essentials bundle can provide meaningful support. We offer a bundle that has vitamin D, curcumin, black cohosh, evening primrose, and some other combination of herbs. And if you're dealing with vaginal dryness or recurrent urinary tract infections, please don't ignore it. Low dose vaginal estrogen is safe, even for women who can't take systemic hormones or take the hormones as patches or pills. It can still, by taking vaginal estrogen, it can prevent serious complications. The most important thing is you don't have to suffer through menopause. There are safe, effective options available, and the right choice depends on your age, your symptoms, and your health history. Talk to your doctor, ask the right questions, and remember the goal is to help you feel like yourself again, whether that's hormones or supplements or a combination or both. Thank you for watching, and here's to your health. Cheers. Good luck.